Hey, magandang hapon muli sa ating mga tagapanood. Kami po sa Coalition for People's Right to Health ay nagagalak po na muling makasama po kayo, no, na matalakay po ulit natin ang usapin tungkol sa raising the bar, no, yung panawagan po natin na hindi lang tayo nagpa-flatten ng curve sa usapin ng COVID-19, kundi ang panawagan natin na pataasin natin ang kalidad at ang mga standards natin sa serbisyong pangkalusugan. So ngayon po, sa araw po na ito, no, ito po ang aming itatalakay sa ngayon at pinamagatang data, paano ka at para kanino ka ginagawa. So ito pong diskusyon po natin, ang talakayan natin ay tungkol naman po sa mga datos. Mga datos na matagal na natin naririnig tungkol sa COVID-19 na pinapakita sa ating mga mamamayan ng Department of Health at ng iba pang mga ahensya ng gobyerno na na nagbibigay ng impormasyon, no, sa ating response sa COVID-19. Sige, pakita ko lang po yung ating mga slide para lang po ma-contextualize lang natin ang ating talakayan sa araw na ito kasama ng ating mga makakapanayam na tatlong speakers natin. So ngayon lang, no, daanan lang po natin ano ba mga nakita na natin sa ating COVID-19 data dito sa ating pandemic response, no. So ito po, no, halimbawa lang po ito. Ito ay lumang data, no. Ngayon po kasi ay nasa 72,000 cases na tayo. Ito lang po yung halimbawa lang, no, kung paano na ba naprepresenta ang mga kaso ng COVID-19 sa ating bansa, no. Ano na po ba yung mga naging inobasyon o ano yung mga pamamaraan, no, para mapakita ng Department of Health ang mga datos, no. Kung una nating mapapansin dito sa pinaka panibagong paraan ng pagpresenta nila ng data ng COVID-19, ang una nating nakikita, no, pag nakita natin yung case bulletin na nilalabas ng Department of Health, ang una-una nating nakikita ay yung pinaka bumubulaga sa atin ay yung total active cases. Ngayon, ano po yung ibig sabihin ng active cases? Ito po yung mga kaso ng COVID-19 na hindi pa gumagaling at mga buhay na pasyente, no? So, minimenos po sa total cases yung mga recovered at yung mga deaths, no? Pero kung titingnan natin, yung total cases na tumataas ng tumataas, no? Nandun siya sa bandang baba, no, na medyo mas maliit. Kumpara natin dun sa napakalaki na 41,464, yung 65,304 po, no, nung July 18, nandun po, no, di hamak na mas maliit dun sa yung lumalabas na bilang ng mga kaso na ito. Tapos yung dagdag, no, yung 2,357 na nandyan po, nandun po sa ilalim, no? Pero yung may kita natin dito, hina-highlight na talaga, no? Mas maganda daw kasi tingnan at sinabi din po ng ating gobyerno na mas communication strategy na daw na mas gagamitin natin yung active cases as opposed din sa total cases, no? Kasi di hamak na mas maganda tignan ang 41,000 kumpara sa 65,300. Pero kung titingnan natin, no, sa Southeast Asia, tayo pa rin ang pinakamarami sa mga active cases. So, isang bagay din po na medyo may problema dun sa datos po na yun, no? Pangalawa, yung titingnan natin yung sa ilalim ng 65,304, kung papansinin natin madalas, no, kung titingnan natin yung kabuuan nitong mga pinipresenta, ay lagi pong nami-mention, no, na merong duplicates that were removed from the total case count. Kaya kung kayo po, no, ay katulad ko o kaya yung ibang mga naghahabol ng sariling datos, no, na meron pong ina-add natin every day dun sa total number of cases, yung additional confirmed cases. So kunwari, 65,304 plus 2,357, halimbawa, meron pong discrepancy dahil nagkakaroon po nung duplicates, no? Kung babasahin natin, nakalagay 54 duplicates were removed from the total case count, tapos may previously reported as recovered. So kung papansinin natin, medyo may mga pagbabago dun sa mga datos sa kahapon o dun sa mga nakaraang mga araw. So minsan din po yung lumalabas natin na total cases ay may mga bawas, no? Batay po dun sa mga duplicates, no? Yung mga naulit na mga pangalan na nililinis daw kada araw. So, sabi nga po, it is subject to change as these numbers undergo constant cleaning and validation. So ito po yung ginagawa po, no, sa ating mga datos sa pang-araw-araw. Maliban po dyan, nandyan po yung issue natin kung late ba talaga ang mga datos, no? Meron talagang usapin ng pagiging late, no? Kung tatandaan natin yung dati, no, na tinigil na po noong early July dati ay meron tayong difference between fresh and late cases na mahalagang matandaan 'no, na hindi po ito ginagawa ng ibang mga bansa. Hindi natin nakikita 'to sa ibang mga, bansa sa ating, kahit mga karatig bayan o kaya sa ibang bahagi ng mundo. Itong fresh and late cases ay isang bagay na mas nakita lang natin sa Department of Health 'no, hindi natin masyado kasing makita ito. Pero ito pong ang paliwanag ng DOH dito ay kailangan daw po kasing ipakita ilan daw yung mga kaso na more than 4 days at ilan yung mga kaso na sa loob ng huling 3 araw. So ito yung ginawa 'no, pero ngayon ay inalis na din po 'no, kasi mukhang hindi naman talaga siya nakakadagdag o nakakatulong dun sa usapin ng analysis ng mga kaso ng COVID-19 'no. Pero kung titingnan natin, yung lumalabas nga talaga kahit sa recoveries at sa deaths, late talaga ang data. Hindi talaga natin masasabi na real time o talagang kunwari 'pag sinabi ng 113 deaths ang reported today, hindi raw pala talaga ibig sabihin nun na namatay lahat ng 113, kahapon 'no. Talagang, um, kung titingnan nga daw yung data nung July 18, eh talagang kalat pa siya. Meron pang mga kaso na namatay pa nung Mayo, may namatay nung Hunyo at may namatay ng Hulyo. Kaya talagang hindi natin masasabi pa na real time o kaya talagang sumusunod sa panahon yung mga datos na lumalabas. Minsan may mga katagalan. No, ito yung tinatawag natin mga delay, ito yung tinatawag natin mga backlog, no, na isang talagang lumalabas na problema sa pag-handle ng data ng DOH. No? So yung makikita natin 'no, talaga bang nagfa-flatten yung curve. Yung halimbawa kasi na problema nitong, datos 'no, yung nasa baba ito po yung nasa ating poster 'no, yung tungkol sa date of onset of illness. Kasi yung problema po talaga kung titignan natin yung graph mag-isa, eh, mukha po kasi siyang kusang bumababa yung mga kaso 'no, na meron siyang parang flattening yung curve 'no. Parang kung tatandaan natin yung initial na itsura nung konsepto ng flattening the curve, yun po yung graph sa bandang kaliwa 'no. Ito talaga yung itsura dapat, nagkukurba pababa 'no, para hindi ma-overwhelm yung health system capacity. Nung una nilang nilabas yung, datos nung Marso at Abril, mukha talaga siyang pababa 'no, kung titignan natin yung nasa taas 'no. Tataas tapos pababa. Dahil ang problema din yung mga last few weeks, for example 'no, yung 2 to 3 weeks na na mula dun sa May 4 'no, ito po kasi yung nilabas na graph ng May 4. Kung titingnan natin yung huling mga araw ay medyo pababa ang itsura 'no. Pero bakit po pababa? It is because kulang pa yung datos na lumalabas 'no, na meron pang mga information na hindi pa available, that is why yung data mukhang pababa 'no. Pero eventually, as the days went by, ito na po yung sa baba 'no, ito na yung July, na lumabas na hindi naman pala siya pababa kundi pataas pa lalo. And this is a problem lang na lumalabas dahil nga yung impormasyon na lumalabas nga ng officially ay meron talagang kabagalan sa paglabas. So initially, it doesn't look like flattening the curve even if it looked like that in April, pero hindi pa rin natin pala talaga napapahupa yung ating first wave 'no. So mahirap na paniwalaan na meron na tayong second wave kasi yung first wave, eh, hindi pa rin natin napapababa 'no, wala pa rin tayong mga araw na zero ang cases o kahit man lang zero ang deaths 'no. So, yun 'no, yung nagkakaroon kasi ng issue tayo dun sa mga datos sa deaths na hindi pa rin natin, bagamat lumalabas nga 'no, na sinasabi ng DOH na pababa na yung deaths based on the date that they died 'no. Pero yung isang concern kasi natin, ilan po ba yung mga namamatay na, hindi natin nakukuhang datos kasi hindi na sila nasa-swab or hindi na sila nakikita ng ospital o ng doktor 'no. Alam natin na yung realidad sa ating bansa, eh, meron pa rin tayong mga, namamatay na hindi nakikita ng doktor ano, yung unattended deaths, especially outside Metro Manila, na talagang, may problema din tayo in that sort of data management. And of course 'no, yung lumalabas natin sa datos ngayon na, yun nga, ito na yung itsura ng 14-day average ng ating cases na patuloy pa rin yung pagtaas niya 'no, despite yung lumalabas nga na information na, we have, 91 testing facilities 'no, but the concern is that hindi pa rin lahat ng region, yung Caraga is does still not have a testing facility. And then yung samples na tested natin per day is yung latest as of yesterday is 23,200 per day, last May 31, 2020. Now, if we're targeting 50,000 na target ng IATF, ay medyo low, 30,000 tests per day. And then yung target of 10 million Filipinos tested by the end of 2020 or even 2021, at our rate, nasa 1 million pa lang po tayo. No? So medyo we have yet to go. We have a long way to go pa talaga. Tapos, depende pa po yan. No? And then, ito po yung isang mahalagang bagay, no? Yung regarding po sa positivity rate, na ito yung nakikita natin, gano'n na po ba kakalat ang COVID-19 sa ating bansa. Yung 10% po kasi ay isang marker na hindi talaga kontrolado or mataas talaga yung mga lumalabas na positive test. Basically, yung positivity rate just shows na ilang porsyento ng mga na-test sa COVID-19 ang positibo. Kapag mas mababa sa 5%, ito po yung mas mainam ayon sa World Health Organization. Between 5 and higher than 5% ay medyo may problema po. Posibleng kulang yung testing or kulang yung testing facilities or talagang kusang dumadami ang mga kaso in these areas. No? So yung may kita natin sa ngayon, ang tinitingnan sa datos, meron tayong nationwide average of 8.6% since nag-start ang ating COVID testing. Kasi ito pong 8.6 ay galing sa 97,881 divided na cumulative positives divided by 1,216,733 na mga tests na in total na gawa na ng Pilipinas. No? So on average, since the start of testing, nasa 8.6%. No? So medyo mas mababa sa 10% pero mataas siya kaysa dun sa 5%. No? Pero kung titingnan natin yung 14-day average, in the past few days, gano'n na ba kataas yung nagpo-positive? Nasa 11.28. So kung may titingnan pa lang natin dito na yung 8.6 and yung 11.28, malaki yung difference po niya. It's above the 10% threshold. Pero mas comfortable po yata kasi na ipakita ng DOH yung total average, no? Rather than seeing things getting worse nitong past few days, no? Yun yung isa kasing mas malaking concern. At lalong-lalo na kung titingnan natin yung in the past 2 weeks, no? 2 weeks ang ginagamit din minsan kasi 2 weeks po yung incubation period of COVID-19. So in the past 2 weeks, for example, ang Metro Manila still has one of the highest, no? Pero aside from that, yung mga karatig bayan din niya, no? Sa karatig rehiyon, yung Region 4A and Region 4B ay tumataas din yung cases. Ang Central Visayas ay tuloy pa rin sa pagtaas ng kaso with the highest positivity rate in all of the country. Pero ang pinaka nakakabahala, yung buong Mindanao talaga yung tumataas yung ating mga kaso ng COVID-19. No, not just Northern Mindanao na nag-start, pero pati Sorsogon and ang Zamora Autonomous Region of Muslim Mindanao, no, na matataas din with the second highest, no, in all of the country. Kaya talagang nakaka-worry, especially since ang Caraga ay wala pa ring testing facility. Talagang mukhang sa Mindanao na yun nagiging epicenter ng pagkalat ng COVID-19 in our country. So talagang merong concern in how the data is being presented and magtitiwala pa ba ang mga tao sa ganitong level ng paglabas ng datos kung hindi na presenta ng maayos. No? The bar series ang ginagawa natin kasi we don't just look at flattening the curve, but we try to go beyond that. Yung pagtaas natin ng kalidad ng ating serbisyong pangkalusugan at kasama po dyan, syempre, yung mga datos na tinitingnan natin na kailangan mas maganda ang pagpresenta ng datos na mas naiintindihan ng mamamayan, mas mapagkakatiwalaan ng mamamayan upang mas maayos, no, yung pakiramdam ng isang bagay, no, yung pakiramdam kung nagdududa pa ba ang mamamayan dun sa mga datos na lumalabas o yung takot, no, dun sa na lumalabas dun sa uncertainty dahil hindi talaga malinaw yung imahen na napapalabas tungkol sa pagkalat ng COVID-19 sa ating bansa. No, kaya talagang kailangan talagang pataasin yung ating standards at pataasin yung ating mga kakayahan sa usapin ng data management sa ating bansa. No? Kaya yan po yung ating diskusyon para sa araw na ito. Kaya samahan niyo po kami dito sa ating mga susunod na mga minuto para matalakay po natin yung ano ba mga problema sa data management, ano po ba yung halaga talaga ng datos dito sa pag-control at sa pag-intindi sa mamamayan tungkol sa pag-manage nitong pandemic. sa pag-engage ng ating communities, at sa pagpapalakas ng ating karapatan sa kalusugan. Yan po, no? So, ngayon po, patuloy na tayo sa ating first speaker. Ang pangunahin natin magtatalakay ngayon ay si Mr. Russel Santos. Siya po ay isang master's student in molecular biology sa University of the Philippines, Los Baños. At siya po ay member ng AGHAM Laguna at bahagi po ng open data team ng AGHAM, no, na talagang pinapahalagahan yung kahalagahan ng pagiging open ng data at nagkakaroon ng independent analysis maliban pa po dun sa nilalabas po ng ating pamahalaan. Sige. Magandang hapon po, Mr. Russell.
Ayan. Hello, good afternoon. So, ngayon, I'll be talking about dun sa mga initial findings dun sa open data group. And I'll be speaking on behalf of AGHAM. Actually, yung open data group na ito, it's actually ay parang project namin siya ng all chapter sa AGHAM Philippines. So we have members in Diliman and meron rin kaming mga ibang mga consultants sa iba-ibang sectors. So let's proceed na dun sa mga presentation. So this regards need natin for transparent and open information regarding sa COVID-19. So, ito yung general outline ng paper namin. And we'll use it as a basis para sa discussion natin ngayon. So, first is yung mga yung i-highlight natin yung mga data quality issues na nakanasin natin ng mga nakakaraang buwan. Second is yung mga epekto niya and yung mga repercussions, yung mga problems natin regarding sa data management sa pandemic response natin. And third is yung pag-build natin ng ano yung mga kailangan para makabuild tayo ng isang transparent and accurate na COVID-19 information for yun nga, para na rin para sa public health. And yung lastly is yung need for open data and transparent governance. So let's proceed. Yung mga issues na ito ay like Dr. Josh said, na-highlight na siya dati pa ng mga previous ones. And some of these are actually revealed by the UK COVID-19 pandemic response team. So, first of all, yung dito sa nakan ng konting mga regularities regarding sa paglalabas ng data, yung mga data galing sa DOH and yung regarding sa data reporting protocols na galing sa mga municipal health office, mga barangay, mga government office, hospitals. So, nangyayari bale, each data drop, nagkakaroon ng variation sa pagitan ng mga, minsan may nadadagdag na mga columns or may nadadagdag na mga tapos minsan nag-shift ng format regarding sa tapos meron yung at times tawag dito. Yung yung bale nagbabago yung mga pertinent info regarding sa mga COVID patients natin. So minsan nag-iiba yung gender nila, age nila, yung location nila. Tapos, meron ring discrepancies between dun sa reports ng DOH at ng mga LGU. Actually, itong mga inconsistencies dito sa mga individual data points, possible na na-occur yan during the validation process. Kaso, yung sa part natin, hindi na-update. Kumbaga, hindi na-expound ni DOH regarding dun sa mga specific na points mentioned. Siguro, one part na rin sa kakulangan nila ng manpower, as mentioned dito sa mga next. Bale, sa ngayon talaga, kulang namamblema sila ngayon sa personnel. Tapos, eventually, nagre-resulta rin naman ito sa problems regarding sa validation ng data natin. For example, ito. At times, actually meron na ring mga duplicate na cases na kailangan na natatanggal or yun nga, nag-aano rin siya. Kumbaga, nagbabago nga ng mga details. Tapos, yung primary problem rin kasi dito ay just, dahil sa low turnover ng validation ng cases, patuloy lang na lumalaki yung backlog niya yung DOH. Sa ngayon nga nasa 22,000 around 22,000 cases na nga yung for validation natin. Yung regarding dito sa this is actually contrary dun sa minsan sinasabi ni DOH na okay na daw yung validation ng data. Pero the previous graph actually says otherwise. We can actually see na meron rin siyang epekto sa natin, sa mga decisions ni IATF and ng national government natin, since yun nga, kumbaga hindi real time ang nakakalap nilang mga datos. So, ang tanong natin, why do we need open data? So, like this, meron tayong mga contradictory statements na galing sa mga experts, mga consultants from the NTF or yung sa ITF. Bale, sinasabi nila na nagpa-flatten na daw yung curve. I think everyone is na stranger sa mga statements na ginawa nung ating mga government agencies. Yung kasi dito, yung value ng open data, actually na-verify natin yung mga statements nila. Contrary din sa mga influencer na ginagawa ni DOH. So, another here is yung sa nung ECQ, bale, nasabi nga na na-flatten na daw yung curve and yung trajectory na nga daw ng mga cases is downward. So, parang early ano na to, early sign na daw para mag-reopen na ng economy, para mag-downgrade ng quarantine to GCQ. Pero nangyayari dito is other opinions sinasabi is hindi nga daw tayo naka-encounter ng first wave. Actually, hindi nga daw natin na-flatten yung curve. So, tuloy-tuloy lang talaga yung ano. So, ito yung recent na statement na ginawa ni Secretary of Health regarding na yun nga daw na flatten yung curve. Independent data analysis has been instrumental para mag-provide ng alternative na opinion o inference sa public, and in turn, kumbaga, it forces our public officials to backtrack or even retract their statements regarding sa state ng pandemic natin. Tapos, ito naman, regarding ito sa yung mga changes na ginagawa ni DOH regarding dun sa communication nila ng mga cases. So, early on, we had yung devolution ng ginawa nilang fresh cases, tapos nilagyan nila ng mga late cases. Ito yung nabanggit nga previously regarding sa validation ng this is probably yung sa we do not actually want to speculate, pero kasi kumbaga it tries to minimize yung current na situation nun para magmukha sa public na ayun nga, bale ganito lang kakonti yung mga current na nag-positive the recent days. Tapos actually ito pa nga bale the subsequent weeks, tinanggal na ni DOH yung distinction between fresh and late cases. Tapos, ito nga, yung mga total cases, binigyan pa ng mas maliit na font, and kumbaga, ilayo nga siya sa hindi siya primary na yun to sa visuals na DOH. So, yun nga, dahil na rin sa inconsistent na reporting na ginagawa ng ating mga executive bodies, nangyayari dito is na-undermine yung public trust regarding sa inflow ng mga data, yung mga pumapasok na data sa atin. So, kumbaga, nagmumukha tuloy na either pinapabango or even tinatry na kahit pa paano minimize sa mata ng public yung actual impact ng COVID. So, pero dito na rin pumapasok yung value ng mga independent na data analysis in forming alternative opinions regarding the situation natin. So, to sum up yung mga effects and repercussions niya. Actually maganda yung mga data drops ni DOH. Bale, compliant sila sa regarding sa open data initiative ng government natin. Pero yung problem sa sa mga data drop nila na kumbaga nadadilute yung message nila dahil sa mga inconsistencies and yung mga inaccuracies tsaka sa mga backlogs nila. Tapos, yung regarding nga doon sa data communication nila via yung mga media channels nila, kumbaga, nagiging cause rin to ng confusion among dun sa working public. Kumbaga, nahirapan rin sila mag-form ng coherent picture regarding sa situation natin today. Tapos, so, yung information na ito, kailangan maging at least traceable siya. Tapos, makikita na pina-verify siya ni DOH para maging basis na rin ito sa decision making ni executive bodies natin and sa regarding sa status ng quarantine natin. So dahil nga sa late na turnover ng data and sa ibang inaccuracies pa, yung mga policies na ito, punatulukan na to ng medyo questionable na decisions. Like, for example, nung previous month, nag-shift si Cebu from ECQ to GCQ. Ngayon, dahil sinabi nila noon na konti nga lang naman yung cases noon. So bakit hindi natin downgrade yung quarantine na. Pero ngayon nakita natin ngayon na nag-shift na yung epicenter ng pandemic downward. Yung nakita nga natin doon sa slides ni Doc Josh, from Cebu, napupunta na tayo sa kumbaga na nagiging epicenter na rin yung Mindanao dahil sa mataas na positivity rate nila. So, makikita natin dito, just a visual inspection, hindi niya sinasabi na nagko-curve na downward yung trend natin. In fact, until today, nag-rise pa rin yung mga cases natin. Tapos, ito naman yung mga nagkakaroon na ngayon ng mga spike sa deaths natin. And ito naman, I'll be presenting ngayon ano yung mga possible na steps or ito yung mga primary focus regarding sa paano natin siya i-mitigate or i-improve. So we have political leadership, mga enabling technologies, yung community participation, and yung institutionalized process. So yung mga data owners, kasi sila yung stakeholders sa organization na accountable para sa quality ng mga data sets natin. So yung problem natin currently, from what we mula sa nakalap namin no mga previous webinars from sa data professionals sa DOH, meron nga daw pagkukulang sa pagdating sa IT sector ng executive bodies natin. So, limited lang daw ang mga roles na katulad na data steward sa DOH and others. So, pagdating sa political leadership, kailangan nating i-scrutinize ano ba ang goals ng national government natin. Ano ba ang gusto nila ma-achieve, ano yung mga priorities, and ano yung mga resources na kailangan i-mobilize for that. So, nakita nating mga problems ng mga previous ones is, first is yun yung militaristic approach na ginawa ng ating national government. Nangyayari dito, natatakot yung public. And in turn, na-disincentivize sila na kumbaga mag-collaborate sa mga efforts ng national government. Second is yun nga, nagkakaroon nga tayo ng conflict sa pagitan ng kailangan balansehin yung pag-reopen ng economy through PQ and dun sa pagkurba ng disease spread. And also, yung to elaborate regarding dun sa militaristic approach nila, ginawa nilang primary na ginawa nilang primary na coping mechanism, not necessarily coping. Pero ginawa nilang primary na solution sa pandemic is yung lockdown. Nagsimula ito sa mga 14 days, so then na-extend ng mga ilang months up to May ata. Tapos nag-downgrade na sa GCQ. Pero nakita, on the contrary, nakita natin na nag-explode pa rin yung mga cases kasi hindi sila nakapag focus regarding this pinaka magandang solution talaga sa which is to test, trace, tapos yung isolate. Kumbaga, we've actually passed that point na I think it's parang dumating na daw sa point na meron ng breakdown regarding dun sa pagta-trace sa mga contacts ng mga patients. So, tapos after neto is yung regarding nga doon sa budget, sa dami ng funds natin, ba ang ina-allocate nila towards pag-increase ng health capacity. So, actually, early on natin nakikita rin dito yung early March nung nag-release ng statement regarding sa allocation ng budget. Kesa lang mag-focus sila sa infrastructure and sa health capacity natin for the COVID pandemic, nag-allocate sila ng mga major portion ng budget sa tourism. That would be a question kung ano ba talaga yung priorities ng national government. Tapos, yung nag-lead naman ito sa early on, yung na-scrutinize naman na maaga. And ito naman, regarding dito sa yung mga institutionalized processes, regarding ito sa mga regarding ito sa paano yung data management, paano yung data flow from yung lowest sa mga subunit, like for example sa mga barangay health units, sa mga municipal health units, sa LGU, and eventually dun sa DOH and the IAT. Another observation nga ng mga previous na mga data stewards sa DOH is that yung data flow na nga ito is really hindi siya integrated. Pero if as we can see later, meron na tayong infrastructure for that. Pero nahirapan lang sa ngayon, nahirapang i-implement ni executive bodies natin. So, on yung to elaborate regarding dun sa ng mga yung flow ng data. Nangyayari kasi each of these subunits, independent silang bodies, tapos kumbaga yung mga nakakalap nilang data, they need to pass it to the next level in the chain. So, nangyayari another round of verification. Kumbaga, maraming hands ang humahawak sa lumalabas na health data natin ngayon sa government. So, yung one consequence dito is yun nga, yung mga nakikita nating mga inconsistencies, dahil hindi integrated yung mga data source natin at the level ng at the level ng provincial government or kumbaga sa DOH, nangyayari dito, possible talaga na dun sa mga data dumps, merong mga encoding error na mangyayari. Kumbaga, basta maraming hands, kumbaga, na nag-handle dun sa data, the more likely is na ma-contaminate ito or magkaroon ng konting discrepancies. So, susunod na tayo. Dito nga tayo sa mga enabling technologies nga sa in this regards, kung paano yung architecture na nangyayari sa paano nag-flow yung from yung sa field, yung mga data sources. So, ipapasok pa nila sa, meron siyang mga intermediate processes. Then, yung sa output niya is yung mga data dump na ginagawa ni DOH. And as well as yung mga public communication bodies na mga websites, kumbaga, yung mga infographics nila. So, yung primary problem lang talaga is actually dito sa logistics part, sa collection, sa pag-aggregate ng mga cases from hospitals, tapos sa ano. So, dito sa logistics ng medyo ito dahil sa primarily sa lack of manpower, yun nga. Sa ngayon, namamroblema rin si DOH regarding sa pag-train, sa pag-recruit ng mga bagong mga encoder, tapos mga analyst. Tapos, dun sa implementation nga ng mga IT solutions regarding dun sa bale, ito, yung mga pag-implement nga ng mga IT solutions. So, actually, currently, meron na tayong mga third party na mga database systems na na-implement primarily sa mga public hospital. And tapos, hiwalay pa dito yung mga iba pa mga third party na mga database systems sa mga private hospitals. So, nangyayari nagkakaroon pa rin ng integration problems. Tapos, regarding dito sa meron nga tayo yung contract tracing app na COVID na Safe and Stay Safe PH na sa ngayon parang very na yung limit na lang yung updates ngayon regarding sa status niya kasi nagkaroon nga ng question regarding din sa mga capabilities and sa mga privacy issues nung app na yun na pagkakatanda ako dun sa isang public na press release hindi nakapag-comply yung developer ng app dun sa mga queries na ginawa dun sa issues niya. Tapos dito naman sa meron naman tayo yung third party na application na in collaboration with WHO, which is yung COVID kaya. Yung problem dito sa mga enabling technologies na ito is these are just mga tools para makakuha tayo, para dun sa ma-streamline ang data management natin. Pero hindi siya yung punot yung primary solution to that. We need to underscore first yung importance ng political leadership just yung community participation. And in fact, we could give some examples na sa ibang mga countries like sa Africa, sa Cuba, kahit may pagkukulang sila sa technical capabilities, na-manage nilang i-curb yung sarili nilang mga outbreak via decisive na mga public health measures. Tapos, ito naman, let's expand dun sa community participation. Ano nga ba yung role ng community sa sa public health crisis natin ngayon? Una is yung community validation and audit. Ito yung sinasabi ko kanina na importance ng mga outside experts and professionals in providing alternative inferences. And yung second is yung participative data governance. Yung, kumbaga, the national government should be open towards criticism, yung questions regarding kung paano nila hinahandle yung data natin. Tapos, ito nga, yung sa open data for peer-reviewed science. So, on the last part, I'll be discussing yung ano nga ba yung current na trends regarding sa inflow ng yung paano dumadalo yung data regarding sa COVID worldwide. Actually, kakaiba yung pandemic ngayon, especially na naging mas malaya yung data sharing between scientists. Kumbaga at times, siniskip na nga nila yung mga conventional na processes like peer review, bali, pinapublish na nila sa mga preprint na sites like bioarchive, etc. Tapos, kumbaga, yung result na ito is mas close-knit yung collaboration natin between yung mga experts sa COVID. Kumbaga, nakakatulong ito sa hindi lang sa international na collaboration, nakakatulong rin ito para i-calibrate yung mga response na ginagawa ng national government natin. So, dito sa Open Science Initiative, yung nagaganap nga is yung tinutulungan ng public sector yung academe para mag-develop ng mga new products yung sa research. To expound on this, yung current na vaccine na recently na napunta sa mga headlines from the UK is actually publicly funded. Tapos, yung manufacturing na pharmaceutical niya, which is Africa, kumbaga nagkaroon sila ng partnership with the UK government para i-keep yung cost of manufacturing to a minimum. This is an extension kung paano gumagana yung yung cooperation between yung public sector kasi academic, yung research, mga research institutions natin. Tapos, sa mga susunod na mga points, yung redundancies nga, tapos yung mga duplications, tapos yung mga pag-expound nga dun sa paano nga natin kinakalibrate yung mga sarili natin response. Tapos, ito na, bali, thank you. At um, makikita nga makikita rin dito yung paano, um, maybe this is a temporary shade kung paano kung paano yung data handle natin currently. Tapos, ayun. If may mga additional mga tanong kayo, ito yung ano namin. Ito yung mga contact details. So, ayun. Thank you very much for listening.
Share, no, I think totoo talaga, no, na napakahalaga ng open data aside from what you mentioned dun sa ginawa ng yung ginawa din dun sa pagkaroon ng open funding for the vaccine. Actually, even in South Korea, no, yung ginawa nila nung even at the start of the pandemic, yung research that went into the PCR kits, no, yung paggawa nila nung pag-push nila for emergency use ng Cgene, Solgen, Cogene, tsaka ST Biosensor were all actually partially funded by the government as well to further yung scientific research para sa pangangailangan ng mamamayan. So talagang the question is, no, para kanino ba talaga yung information and yung research na ginagawa natin, especially on the side of the development of science in our country?
Actually, yung sa UN talaga is matulungan yung public sector natin. We can use a single na example. Medyo nalalapit sa sigmura natin. Yung regarding dun nga sa approval and sa support sa mga local test kits natin. Kasi sa ngayon kasi nag-average around 5,000 yung presyo doon sa testing natin. Pero yung sa locally made na kits natin, we can achieve a cost of at least around mga 1K. That's actually a major na improvement regarding sa budgets, logistics. So, it's a primary question na bakit hindi na tulungan para ma-develop itong kit na to early on. Actually, we could late na nga siya, mga March na, April, before even punta siya sa public eye. Kumbaga, it took us around 3 months, 2 to 3 months, para lang magamit ito. So, in the end naman talaga, yung data na nakakalat natin is really para sa public good naman talaga. And yun nga, regarding sa mga data analysis na ginagawa ng mga independent natin. So, kumbaga nagiging counterpoint na rin ito para sa mga sabihin natin ng mga narratives na ina-expound ng national government natin. Like yung recent, actually ito gusto ko itong example na to, yung narrative na pasaway daw yung mga pamatayan natin. When in fact, dun sa track data pa lang, sa mga inferences na nakuha natin mula doon sa tayo nga daw yung may pinaka-highest na compliance rate pagdating sa ilang mga policies like mask wearing even dun sa pag-travel. Di na lang yung question kung paano na-inform yung public regarding sa current status natin. Siyempre kasi may konting dissonance pagitan doon sa sinasabi ng national government and nung mga bunga nung open data collaboration and yun sa analysis. So napipilitan silang sagutin or at least napipilitan silang sagutin at least or even yun nga mag-retract sila ng mga statement nila medyo irresponsible nga sa part nila na naglalabas sila ng mga statement na gano'n when in fact yung sa nagdi-differ nga sa consensus na beyond dun sa circle nila ng mga consulting bodies.
Right. Sige, thank you very much, Russel. Balikan na lang natin kayo mamaya dun sa ating questions, no? From the public.
Okay.
Sige, so thank you very much ulit from AGHAM Laguna and the AGHAM Open Data team, si Mr. Russel Santos. Sige, so for our next speaker, sige, going back lang, no, dun sa napag-usapan na natin. So we talked about yung kalagayan ng data and yung what should be done, no? So in light of that, no, so yung next speaker natin is a speaker from Western Visayas, no? So pakita ko lang yung sa slide ulit, no? Yung alam natin yung kalagayan ng ating pagkalat ng COVID-19. And actually Western Visayas has been one of the relatively lower na cases of COVID-19. Hindi siya parang nagkaroon ng surge in Eastern Visayas and Central Visayas. Western Visayas relatively hindi ganun kataas, no, yung kanilang surges. So we want to know more about that and with regards to yung data management that was actually being done in this region, in this part of the country. So our next speaker is a graduate of public health and medicine, as well as having a PhD in molecular medicine. No? So she is my classmate from the UP College of Medicine, class 2016, and is presently the supervising science research specialist of the Center for Informatics at the University of San Agustin in Iloilo. So without further ado, I give the floor to Dr. Pia Zamora.
Wait, let me share my screen first. Okay, so good afternoon, everyone. I'm Pia Zamora, an affiliate of the University of San Agustin, Iloilo Center for Informatics, and I'm here to talk about yung data work that we've been doing on COVID-19 since nagsimula ito in Western Visayas. So the work that we've been doing is in collaboration with professors and students from the University of the Philippines, Manila College of Medicine, and an epidemiologist, Dr. Emmanuel Sebelleja from the National Center for Mental Health. So this presentation will touch on possible issues on COVID-19 testing and contact tracing in the context of the government's response in Western Visayas. So, hindi naman to kaila sa lahat that the aim of the quarantine measures that we've had varying levels of since March 2020 was to prevent a surge in cases and deaths that could overwhelm the healthcare capacity. And during this time, it should have given us time to increase testing capacity, amplify contact tracing of patients, and then of course to augment or to increase the capacity of our health facilities. So in these three, how has Western Visayas been faring? So now we go to testing capacity. So first, the data that is presented here is from March 26 to June 2. So during this time, only the Western Visayas Medical Centers of National Laboratory was the COVID-19 testing center in the region. And it is located in Iloilo. So as of June 2, so that the lab was able to test approximately 11,200 individuals. And on 3 separate dates, May 10, May 18, and June 2, the percentage tests per capita, yun yung percentage of the population na na-test na per province. So it was computed and it showed that the highest percentage test per capita was in Iloilo. So why is that? So it is possible na yung presence of the testing center in Iloilo, it places the province at an advantage as its healthcare facilities can immediately transport samples to the facility for testing. Now, so this finding is interesting in light of the tally of cases in the region during this time. So hanggang June 2 itong graph na to, wherein it coincides with the highest number of cases also in the province of Iloilo. And coincidentally, may rough observation during that time nationwide that the regional location of your COVID-19 testing centers seem to always give the highest number of cases. So this is what we call the streetlight effect. So the streetlight effect is we look for answers where the looking is good and convenient rather than where the answers are likely to be hiding. So wherever the light is, that's where we look for data. Now, in this, we recommend that more testing, sorry about that, more testing centers should be set up to enable equitable access to laboratory testing. And for also, we recommend, it is recommended to test a representative sample of the population in the region, hopefully to reach at least 2%, since yun naman yung aim ng national government natin is to test at least 2% of the population to really see the picture of COVID-19 nationwide. Now, interestingly enough, it was in June 2 that another laboratory was also became operational in the region, and it was in Negros Occidental. And the number of cases in the province, it shot up in like 2 weeks, now even surpassing the number of cases in Iloilo. So this just shows that you increase the testing capacity for COVID-19, and when you increase access to it, it will give us a better glimpse of the COVID-19 scenario in the area. So that's it for the putting up additional or testing centers in remote provinces. So now we also tackle the overall processing time of samples. So usually ito yung nagiging it's a frequent issue since the pandemic started. Yung delays incurred in testing. So this analysis included 103 confirmed cases in the region. Okay, so there. So we have here the overall processing time. So we had data wherein we could subdivide this overall processing time into two. So the first component would be sample collection to the receipt of specimen by the laboratory. So this includes transport logistics. And the second component includes the duration from receipt of specimen, the time na tinanggap ng laboratory yung specimen, and then na-process, the validate, and then nag-release ng results. So now, if we focus the overall processing time again, we see here that Negros Occidental and Antique, they had overall processing times of at least 5 days, compared to the other 4 provinces, were in approximately 3 days. And then, and this differed significantly with that of Iloilo. And we want to know which of these components may have contributed to such a delay. So now examining the first component, so we observed that majority of the specimen from Iloilo to Capiz, they were sent or they were received by the laboratory within 24 hours. For Aklan and Antique, within 24 to 48 hours. And for Negros Occidental, majority of which na-receive within 24 to 48 hours. And there were even samples na sent more than 48 hours na after sample collection. So, taking into consideration the proximity o yung lapit ng different specimen collection sites to the laboratory, the estimated travel time from provinces within Panay Island to the laboratory range from less than 1 hour up to 4 hours. That's within Panay Island. So, yung provinces within Panay Island, Iloilo, Capiz, Aklan, and Antique. And then, for Guimaras and Negros Occidental, so Guimaras kasi, usually, on a normal day, there's like a 15 to 30 minute na ferry ride. And then nasa Iloilo ka na, to and from Guimaras. As for Negros, merong 1 hour and a half na ferry ride. So for Negros Occidental, it takes about 2 to 5 hours for specimens to be transported, and thus the travel time from Negros Occidental may have contributed to the longer overall processing time. And it is also possible na dahil they have to like send the specimens in bulk para sulit yung pag-transport ng samples to the laboratory. And baka nag-iintayan before transporting the specimen by batch, which led to the processing delay. So that's for the sample collection and transportation. So it seems like at this point, Negros Occidental, mahaba yung time na natitake for the laboratory to receive the specimen. So now we go to the processing and results validation. So it is during this time na na-receive na ng lab, processed, and then validated, and then results were released. So a significant difference was found naman between in samples from Antique. So such a difference requires further examination since it was not found between Iloilo and the other 4 provinces. Parang what could have been factors na affecting the such time component since all of this are being done already in the laboratory. So this requires further investigation. Also, so presumably processing all happens within the testing center. So yun nga, it is peculiar that there seems to be disparity against samples from Antique. And if there's also an issue wherein possibly may prioritization protocol when it comes to the symptoms of the patients na kung saan nakukuha yung specimens. But if we look at the case classifications of the 103 COVID-19 positive individuals, they were of severe acute respiratory infection and influenza-like infection, yung mga nilalagnat lang. And then there were also asymptomatic contact. So in all 6 provinces, may ganong, lahat sila may ganong mga classification. So it seems like walang prioritization based on symptomatology alone. So it may have stemmed then from other factors. And then overall, so nandito na ulit tayo, babalik tayo sa overall processing time. So it seems like yung Negros Occidental delays stems from possibly from transport logistics, and then for Antique would be yung processing time in the laboratory, and then yung validation ng results up to its release. And again, we don't know what's really happening there. So there has to be an explanation bakit sila na-delay. So now with that, so it is recommended actually na yung transportation and processing of samples must be improved in order to correct the disparities observed between provinces or among provinces. And then of course, the role of the respective LGUs should also be increased or highlighted, since they have to play a role in the timely, proper, and secure transfer of specimen from their localities to the testing center. Especially in the case of Negros Occidental, when during the time na isa pa lang yung laboratory, meron silang land travel, and meron din silang sea travel. And of course, there's also the transport of specimens involved. So that's it for the testing capacity. So now we go to the another approach ng government, and that is contact tracing. So the data included in this analysis are of the 104 confirmed cases as of May 18, 2020. And during this time, of the 104 confirmed cases, they were able to identify 3,503 patient contacts. So we don't have data actually on the length of time that the contact tracers were able to actually track or identify the contacts of these patients, and the length of time na na-incur when these patients were traced. So out of the 3,503, only 3,420 were traced. And then these untraced contacts were likely encountered in the community, workplace, and during travels. During this time, baka nagsiuwian na sila, and the local contact tracers can no longer get hold of them. And then, interestingly enough, out of the 3,420, only 1,668, or approximately 50% were tested. So why is that again? So although yung contact tracing seems to have high coverage, it seems delinked from testing by 50%, and thus the guidelines for testing patient contacts may need to be reviewed, revised, and enforced among all contacts. So other than that, there is also another recommendation wherein we should digitalize the contact tracing process for efficient reporting and data analysis. Because as of now, I believe that, sorry. So as of now, ngayon kasi, there is the app, the Stay Safe app. So I don't know how it's being implemented nationwide. And with that, kasi we also need to increase our own number of contact tracers, and we also have to train them on how to use the app so that they can use it efficiently for contact tracing. So now, at the University of San Agustin, we actually developed a community contact tracing and monitoring tool. So this is not necessarily, hindi siya LGU focused, so it's a community-based tool. So meaning if the communities, for example, the school or private institutions, they want to keep track of their members, they can actually use this app. So it can actually complement the efforts of the government on contact tracing, wherein the private institution does not have to go to they does not have to go through all the channels, national government or local government, in order to get the data, whether or not yung member ba nila or yung employee nila is COVID positive, or whether or not yung contact ba na to has symptoms or not. So they can actually do it on their own, and then link the said data to local government units. So it sort of complements the government's efforts on contact tracing. And this app was actually used by the National Center for Mental Health when they were having an outbreak, and there's also the plan to roll it out in San Agustin when school opens, so that we can be able to quickly keep track of potential outbreaks and have the data for decision making, both for the school and of course the local government unit, the local government of Iloilo City. So in this tool, so you have the contact tracers. The contact tracers have access to this tool, and of course there's also yung mga direct contacts or individuals na may direct contact with a COVID-19 patient. And of course there's also the portal wherein the DOH or WHO or even the local government unit can actually access, so that makakuha din sila ng aggregate data from the said institution regarding the employees who are positive and his or her contacts. And you can actually access this. It's free at this site. So parang in a nutshell, ito lang din yun. So there's patient and contact data collection. Initially, the healthcare worker, possibly if it's in a school setting, the nurse or the doctor or the school physician, collects patient data, processes or inputs patient data, and then logs it or inputs it into the database. And then, of course, from this list, nandun na rin yung contact tracers. So they have a list of the possible contacts, and of course, they notify these contacts for quarantine and monitoring. And then from here, for those who need to be monitored, merong list of people to be monitored daily that will be generated from the database. And then from there, a link din yung yung testing results ng mga contacts na to. And then these also gets updated, yung results ng mga contacts. And then if they become positive, so we go back again to the role of the healthcare worker, wherein they collect patient data and the entire process begins again. So that's it for contact tracing. And of course, lastly, to augment our health facilities. So as of June 19, 2020, the region had 99 hospitals housing 586 COVID-19 dedicated beds, 82 of which are ward beds, 55 are ICU beds, and 449 are isolation beds. So itong 99 hospitals na to, they're actually distributed all over the region. But if you look at the hospital bed capacity per province, so mataas talaga yung sa Aklan. So that's approximately 10 beds per 100,000 population. And then followed by Iloilo with 9, Capiz 7, 6 by in Negros Occidental, 5 in Antique, 1 in Guimaras. Now, if we look at the utilization rate, it seems like wala pang problem yung Western Visayas when it comes to utilization. So hindi pa overwhelmed yung capacity natin. However, if it now that the number of cases are actually rising, kahit na they are locally stranded individuals or OFW repatriates, we still need to be prepared for a surge. So that's for yung hospitals. Next, there are also quarantine facilities. So in the region, we have 281 quarantine facilities with approximately 10,800 beds. And they actually house patient contacts and mild and asymptomatic cases. So with respect to each province, bed capacity, quarantine bed capacity per province, so Antique, highest siya, with 313, followed by Iloilo, Negros Occidental, and the rest. Now, if we look at the utilization rate naman ng quarantine facilities, remember ito yung sa labas ng ospital. These are for the mild and asymptomatic cases. Overall, yung daily utilization rate for Aklan, Antique, and Capiz has not yet exceeded 60%. Pero yung Iloilo and Negros Occidental have risen to more than 70%. So the respective local government units of these provinces must prepare contingencies in case the capacity circuit are exceeded. So during this time, malapit na siya. And this is only in June 21. So the recommendations then for the hospital, for the health facilities, is to monitor admissions and release, both for hospital and quarantine facilities, as well as demand, all in real time, so that we can immediately report or we can immediately mobilize contingency measures once the capacities are exceeded. And of course, this actually is the scenario sa first district ng NCR. So this was in like July 18. So during this time, more than 70% na. Yung ano nila dito would be, we're already in the danger zone. So they need to have contingency measures in place. So what are these measures? And in light of this, if our Region 6 facilities are not yet overwhelmed, in case this happens, the one that's happening in NCR, in case this happens, do we have a contingency plan in place? So actually, that's it for the three-pronged approach. So that's contact tracing, testing, and then yung augmentation of health facilities. So again, thank you, everyone. So we would like to thank Dr. Marilyn Convocar, Dr. Glenn Alonsabe, and the rest of the DOH Resu 6 for granting us access to data. And of course, to our collaborators on other COVID-19 projects, that will be the UP College of Medicine, National Center for Mental Health, University of the Philippines, Visayas, and University of the Philippines, Diliman. Also, before I end, I would like to actually let you see the toolkit that the Center for Informatics has. So this is the COVID-19 toolkit, and then It has local and nationwide data and visualizations on COVID-19. And then also in this tab over here, COVID-19 Toolkit, we also have your community contact tracing and monitoring tool, the one that was discussed earlier. And then, of course, yung there's also another app, the PPE Needs Dashboard, that we use to actually augment government efforts in monitoring and, of course, distributing PPEs to small health facilities who actually have no access or no direct access to suppliers of these or those who donate PPE. So with that, again, thank you for having us.
With regards to the open data, I know you have a lot of data that you got yung nakuha nyo no, dun sa DOH Region 6. No? Were there any problems ba dun sa pagkuha ng data or usage of the data that is that should be actually public data?
Actually, Josh, more of there are problems when it comes to. That's why yung we have limited data on, for example, yung overall processing time because we are actually given dates. But some of them we had to check or have them validated again by employees from DOH since I think nagkaka-typo because they are being manually inputted.
Encoded.
Yes, encoded sa Excel file nila. So yun, one of which would be that. And then right now I think nag-improve yung DOH in general in terms of giving us access to data because before we only had numbers. Parang number of cases. We don't know who these people are. I mean where they're from but right now at least other than the case profiles, we also know which lab actually tested their samples. So we can sort of link or kung ano ba yung testing capacity ng laboratory nito, especially na Region 6 na dalawa na rin or dadami pa actually yung testing centers namin other than the one we have in Iloilo.
I think nasa 3 or 4 na yata no in Western Visayas. Parang may isang bagong public hospital that was approved no. And something remarkable din actually there are relatively more public hospitals no na in Western Visayas na approved for testing compared to the other regions na talagang mix of public and private or more private ganyan. So yeah. And then yung isang concern din I remember before meron nagko-comment din sa amin no, in our previous webinars na there are some regions, there are some provinces in Region 4B na parang for them in Region 4B since ang meron lang nila na testing facility was in Palawan. And for example, yung mga ibang areas like in Romblon and Marinduque na mas madali pa raw sa kanila to go to Region 6 rather than to go all the way to Palawan. So would you have any idea kung na-pick up nila yung ganun?
Actually, yung data that was given to us was purely of Western Visayas eh. So we actually don't know if yung nadadagdagan pa yung not burden pero more of workload during that time sa Western Visayas when it was the only laboratory here in Iloilo. And of course, I think it does cater to the nearby provinces kahit it's not of Region 6.
Region 6.
So yun. Yes. So actually, the one in Negros Occidental, they also cater to samples from Negros Oriental. Just location-wise kasi magkadikit lang din yung Occidental and Oriental, even though they're like the same or a different region.
So Negros Oriental, I think wala pa yatang testing facility.
Yes, wala. Pero they send their samples to the testing centers in Negros Occidental.
Rather than Cebu.
Yes, rather than Cebu. Kasi with Cebu, they have to travel pa over sea. Yung kasi, magla-land travel lang sila eh.
Would you know kung ano yung statistics ng Negros Oriental? Is it closer to Negros Occidental?
I don't have access to data at the moment.
Yeah, pero at least, diba, yung nakita natin yung at least it with the app that is open sourced as well. So parang kahit pa paano it's easier and more democratic para dun sa ating sa average person to be able to access no. With regards to the contact tracing, has it been more widespread yung paggamit ng app to the average person in Region 6?
We don't know yet. Actually, we have no idea how to contact tracing. As in, when we got the data, it was actually in Excel. That's why nga we don't know if, well, yes, indeed, medyo maganda yung coverage sa pag-identify ng patient contacts and sa pag-trace. But we don't know how long it took them to actually have those names listed down. So, hindi natin talaga matitrace yung efficiency ng contact tracing in the region without that.
Hindi pa natin masabi for now. No? So talagang there are a lot of things, but at least there are some initiatives that are being done.
Yes.
Syempre with the help din of the yung sabi nga kanina ni Russell, it's the more independent side as well. No? Hindi lang especially since government can be overwhelmed and in some respects may inefficiencies as well. No? Sige. So, thank you very much, Pia. We'll get back to you later ulit para dun sa questions natin from our audience. Sige. Thank you very much, Pia.
Okay. Thank you, Josh.
Okay. Sige. So, we saw, nakita natin yung mga kalagayan natin dun sa iba't ibang mga na-discuss ng ating first two speakers. Again, the importance talaga nung lahat ng factors na nangyayari dun sa COVID-19 response natin that we have to strengthen yung testing, yung tracing, and yung validation. That at the end of the day, ito pa rin yung mga mahalaga para talagang masabi natin maayos yung data. We cannot hope to have good data if the initial processes are not being done properly. No? So with regards to that, so yung punta naman tayo dun sa ating reactor, to our two speakers. Our last speaker and reactor is a public health student at the University of the Philippines, Manila, and is also was also part of the, he was a former research associate of the National COVID-19 response previously. So yung experiences that the COVID-19 response has had, and with regards to what our speakers have discussed, I would like to introduce everyone to our reactor for this afternoon, Mr. Carlo Lorenzo. Carlo, good afternoon.
Hi, good afternoon, everyone. Good afternoon, Doc Josh.
Sige, so ano tingin mo, Carlo, dun sa mga na-discuss ni Russell and ni Pia? How does it, with all the situation na nakaharap natin, how patuloy na pagtaas yung COVID-19, how would you react dun sa mga na-bring up nilang points, and how is it apply dun sa mga current problems and yung situations natin sa COVID-19?
Yes, first I'd like to thank Mr. Russell for presenting a very comprehensive, what are the current challenges and problems that we're facing when it comes to data and possible solutions. And I'd also like to thank Dr. Pia Zamora for presenting a very comprehensive, not just diagnostic and management, but also prevention and control approach when it comes to COVID-19 in Western Visayas region. I think all of what she presented is very, kumbaga parang acceptable doon sa population ng Western Visayas, which is really what we need. Kasi kailangan natin ng responsive na interventions, hindi lang basta parang mga dekahon na mga solutions. So I've divided my points. So based on their discussions, I divided my points into 3. So first is about the open data. Second is about the current processes and efforts of the DOH and the IATF. And third is about leadership and connection. So these are all based on the presentations, 2 presentations before me. So for the open data, it is really needed. I think open data is really needed for scientific collaboration. I cannot express enough kung gaano ka-important yung open data. So, pero before open data, I think it is advisable kasi what we see lang is the output. What we see is the data na doon na siya, process na siya, na-evaluate na siya. So, hindi natin nakikita yung processes below it, yung data traffic behind doon sa ating mga sa DOH data drop, right? So, I think it is advisable to have a rapid assessment on the process flow, data traffic. This should involve all stakeholders, different institutions, hospitals, community swabbing facilities, LGU, even the public, di ba? And from our frontliners, of course, even the testing laboratories, the DOH, the CESUS, even the funding agencies, and experts that are external to DOH to capture the real picture ng ating data process and data process flow and then our data traffic. We can here in rapid assessment, makita po natin yung possible na mga bottlenecks and more challenges na hindi natin nakikita on the surface when it comes to data consolidation, reporting, and even our data analysis. Next is, when it comes to validation, I think Mr. Russell presented kanina about data validations, mga nagbabago yung sex, nagbabago yung age, nagbabago yung residence. When it comes to residence, I think it's acceptable naman siguro. But kasi mostly when we are filling out forms and hindi na yung sinusulat nating address, because the population is diba? Of the Philippines is mobile. So usually may bahay ka sa QC, but you also have a house in Pasay. So I think isa to sa bottlenecks na nakikita ko na when the patient is filling out a CIF or case investigation form, no one's checking about the legibility or accuracy ng mga sinusulat nilang informations. I think one of makakapture natin yon sa rapid assessment. And sometimes, nagbabago po talaga yung sex and age, kasi nga po hindi malinaw yung pagkakasulat sa CIF. Nagbabago naman po siya when it comes to case profiling. So we have case profiling po kasi actually we have double efforts for case profiling. It is advisable to have double efforts actually when it comes to surveillance, disease prevention and control. It's really advisable para makuha po natin yung pinaka-accurate na data. So when we call the patient, when we call the relative of the patient, if the patient is tube or critical, nagbabago po talaga kasi sometimes the birthday, the age, hindi siya legible or even the sex. So dito po natin na-validate yung ating data. But I think it's not acceptable that we have a 20,000 plus backlog. So if yun nga, babalik ako, if we do the rapid assessment, we'll see saan ba talaga yung bottleneck dito. Maybe it's the lack of staff of the DOH or the volunteers doing the case profiling, the data validation, and whatnot. Also, I'd like to, regarding open data, also, I'd like to discuss CART. So we have CART po kasi in public health. So that is CART. So C stands for completeness. So we should capture the completeness of the data. Hindi lang siya completeness ng form, hindi lang siya completeness ng pagsagot or yung pag-validate ng form. It's also capturing all those yung mga dapat nagsasagot ng CIF. So even all the probable cases or even the positive cases, pag magsasagot sila ng form, dapat lahat sila makapture natin for completeness. And then A stands for accuracy and R stands for reliability. So our data should be reliable and accurate. So paano, di ba? So dito po papasok yung ating open data through scientific collaboration. So yun nga, I'd like to emphasize again na bakit scientific collaboration pa, may gumagawa naman na ito. Again, doubling of efforts, rechecking, reevaluating in public health surveillance is really important. So the last one is T, so CART, right? So completeness, accuracy, reliability. And then T, I think ito yung pinaka-important, timeliness. So timeliness, yung data ba natin, up to date siya. So nakikita natin na nagre-report ng deaths ng July 23, pero yung namatay, June pa, di ba? So, hindi, kasi statistics and data is used for evidence-based approach and actions, di ba? And I think our approaches and our actions will not be accurate and science-based if our data is not timeliness. And also, if our data is not timely. And also, if wala yung timeliness doon sa data mo, makaka-affect siya sa reliability kasi hindi na siya reliable eh. Also, hindi na rin siya accurate kasi nagre-report ka ng deaths, nagre-report ka ng cases ng 1 month na 1 month na palang dapat na-capture. And ultimately, hindi na complete yung data mo. So, what you are doing, what you are presenting, na actions, na interventions are hindi na po applicable doon sa current na conditions ng public. The next important point na I'd like to discuss is the current processes and efforts. So this is more on, so public health po kasi ako no? So I am not more on diagnostic and management, I am more on prevention and control. So this, ito po siguro more on contact tracing efforts tayo. So I'd like to thank Dr. Pia Zamora for presenting the side of the contact tracing of the Western Visayas that gave me a parang structure po ng aking mako-comment. So according to my senior professor or in UP, so our contact tracing efforts as of today is infantile. Kumbaga, sanggol pa po. Kasi inuna nga po natin yung diagnostic and treatment. I think that's really normal in the Philippines kung saan po talaga, kung ano yung nakikita nating problem, yun po talaga yung binibigyan natin ng solution. So kapag may nagdudugo na, syempre, tatapalan mo yung sugat, di ba? So that's okay, pero we should also give importance to prevention and control, which is contact tracing po talaga. I think the contact tracing right now is being led by the DILG. So the contact tracing is a public health function. It is not, I'm sorry, it's not a DILG function, but I think if there's a support from the public health people to the DILG, I think mas magiging guided yung ating contact tracing. I think most ng ating LGUs, our CESUs naman po, they're doing their best. But some of our CESUs are using the barangay, community mobilization, but there are also LGUs na gumagamit po ng militaristic approach. And what do we know about police, pag meron pong police presence or military presence po doon sa lugar natin. So there are studies po, di ba, na mas naihinder po yung ating health interventions kasi there are fears. Alam naman natin with the current state of our country, there are impunity, police brutality, and these policemen are not trained to do a public health function po, di ba? So I read an article online about IATF suggesting the use of chismosas for the contact tracing. I think the term is wrong, but the idea is there. So it should not be the chismosas or chismoso. Well, they can be if willing silang matrain. But I think we should use the term community champions. So there's a lot of health projects na gumagamit po talaga ng community champions. Why? Because the lone rationale behind this is mas tiwala po yung ating mga kapitbahay doon po sa, mas magkakatiwala po yung mga magkakapitbahay kaysa po doon sa mga external people going into their communities, giving intervention. So if we mobilize our communities, if we empower them, I think for the contact tracing, it would be a great help para mas ma-identify, ma-monitor po natin yung mga possible close contacts ng ating mga confirmed case. Also, lastly, I don't know how to connect this, but yes, we have a weak health information system. And in a country wherein you have a weak health information system, you should rely on warm bodies po, di ba? Doon po pasok yung ating community empowerment and mobilization. So lastly, my last point for today is about doon po sa pinansin ni Doc Pia and ni Russel. Based po to doon. So more on leadership, solutions, and connection. So we all know that the first step in solving a problem is acknowledging the presence of the problem, di ba? And the DOH and the IATF, even our president should be transparent about the current condition of the data, di ba? And not just that, but also the proposed solutions, the funding, yung mga inutang po natin, napakadami po nun, di ba? So, saan po ito napupunta? Hopefully, makita po natin kung ano po yung mga public health solutions na pwede po ma-present sa current nating problems from the government po mismo. And then, scientific collaboration, I'd like to reiterate that. So, there's a lot of experts, statisticians, epidemiologists, external to the DOH, even organizations and individuals presenting na makakatulong po sila doon po sa ating data validation, data analysis. I think if the UH or the IETF should accept these help from these external people, external organizations, external experts, we will have a more comprehensive, a more effective, and a more responsive surveillance system and public health and control system. Lastly, so for my last point po talaga, this is the last point, is the connection. So it's not just connecting different sectors. Well, dapat po talaga kinoconnect po natin because COVID is not just a health problem, diba? It's also economic problem, social problem, but we should also look into the connections of the national and local response. We should also look into the connections between the hospitals, community swabbing facilities, barangay health station. We should look into the connections of, yun nga, masyado tayo nag-focus sa diagnostic and management since wala pa pong treatment ang COVID. Napapabayaan po natin yung prevention and control side. So there should also be a connection between that three. And then lastly, there should be a connection between our leaders, our president, of course, the IATF leaders, the DOH, they should be transparent, diba? They should connect from the communities. This is to ensure that no one will be left behind. Thank you. So if you have questions po, kindly raise them into the chat box.
Okay. Sige. So thank you very much, Carlo, no, for that very concise and summative reaction to our discussants, no, and to our general discussion for today. Talagang yun kasi yung concern talaga natin, no, that I think tama ka, Carlo, na the concern is that, di ba sabi nyo kanina, masyadong nakafocus tayo dun sa treatment, sa diagnosis. I guess that's also the concern kasi masyadong clinical yung approach natin with regards to COVID-19. We forget that, we neglect and forget that public health approach. No? That sometimes, I guess, yun talaga yung concern na that masyadong medical or masyadong nakafocus tayo talaga on that treatment and the diagnostic aspect instead of looking at the preventive aspect and really the control of disease in general. That in addressing what the public really needs and what the public can do, rather than just looking at what the hospitals and what the health professionals and the services are being made available. You know, that it really has to be that emphasis on preventing disease and mitigating these the spread of disease in general. No, na hindi tayo kailangan umasa lang dun sa pagpapagamot. Sige. So can we get all our speakers and Reactor on the screen, and then we can go to our comments that were left, no, in our Facebook and our YouTube accounts. Okay, so can we get Russel, Dr. Pia, and Carlo back?
What?
Hello? Yeah.
Hello? Hello? Hello?
I don't understand the question.
So we have a comment here.
I think that's a test regarding this Yung
Okay. Sige. Can we show yung comment is available? Sige, I think ito po from our YouTube page, from Vena Pearl Bongolan, that we interfered with the natural course of the epidemic. Our simulations show that we never actually reached the peak change quarantine. I think this is yung sa ECQ or sa MECQ and GCQ, I think. Yeah. So, I think may connection, may kadikit pa yung kanya. To that, does anyone want to respond? Since we, was there really, alam ko may connection pa to, na isa pa niyang sinabi sa isang comment. But yeah, in general po, no. So I think what the comment was about is regarding dun sa the epidemic course, no, because of the ECQ. Siguro yun na lang muna. With regards to this, no, was there really a change? Do you think malaki ba yung naging kasi yung forecasted peak daw is in 10% in Quezon City around September daw. So yeah, does anyone want to comment regarding daw dun sa natural course of the epidemic and how the quarantine was able to shift it? If some people would say, you know, that because of the change talaga na tumaas yung cases natin in late May, and then skyrocketing in June and July. Is it because of that switch in the quarantine norms that we allowed to loosen by May 31?
Actually, there were infographics.
Based on the data.
Parang nabanggit nga na 75% na ng mga bagong cases ngayon ay galing sa nung GCP pa lang. Tapos,
would anyone like any of our speakers?
Hello?
Josh, can you hear us?
Hello? Hello? Actually, yun nga, may mga references na napakita na 75% na ng mga cases na lumabas ngayon is galing nga sa from nung nag-GCQ tayo as compared to 25% nung
Sorry, Russel, medyo garbled yung audio.
Sorry.
Yeah.
Hello na. Medyo malabo ako. So, bali nga,
Sige, Russell, go on.
Sorry. Bali, yun nga, may 2-month time span, nag-accumulate na yung mga cases natin to around 3/4. 3/4 na ng mga total cases. So, it's either dahil nga nag-expand so I think mas maiging tingnan natin siya compared sa yung i-compare natin yung positivity rates ng mga ng mga each testing day. So actually napakita nga rin sa na tumataas pa rin yung positivity rate kahit yung dito. Bali kasi kapag yung trend kapag for example, kontrolado mo na yung outbreak like nasa downward trend na yung tapos tumataas yung cases, yung trend pa rin is yung positivity rate, parang downward shifting na. Pero nangyayari, parang na-maintain lang yung positivity rate na around 6% at or 7%. Pero yung kagandahan niya yun actually is mas nagiging granular na nga yung variances sa pagitan ng mga positivity rates per day. Unlike dati na kumbaga talagang taas-baba yung positivity rate. Ayun. Hello?
Hi.
Sige, Carlo, you want to answer
Yes.
regarding
I'd like to add lang some points
intervention?
from the answer of Mr. Russel. Intervening with the natural trend of the disease is actually a public health function. So it's very important na nag-i-intervene tayo dun sa natural trend ng disease. Kasi pag hindi tayo nag-intervene, mas mag-spread po yung mga disease natin, mas madadami po yung infections, and mas madami po yung deaths. And I think one of the interventions na na-present nga po sa atin is the quarantine, right? You might say that other countries are not using quarantine because they have their maximum testing capacity. So they test, isolate and treat their population, but they didn't restrict their populations from being mobile. But in our country, nag-umpisa po tayo, nag-one testing facilities lang tayo, very low yung ating testing capacities, where in fact, dapat po talaga mataas yung ating testing capacity with the budget na meron po tayo. But what they presented, konti lang daw po yung ating testing capacity and facilities. So we have this quarantine. And for me, personally, quarantine captured yung mga possible infections na hindi po natuloy. Kasi nga, naka-quarantine ka, so wala kang exposure, wala kang possible exposure. Yun. So yun po. But currently, even if, with regards naman po dun sa dumami yung ating cases, no? Dumami yung ating cases this June and July, I think it's because we have more than 80 laboratories, certified laboratories to do the testing capacity, to do the testing. So we have a larger testing capacity now, but as of the moment, wala pa rin po tayo dun sa call ng public at even ng ating experts na mass testing po talaga. Currently, wala po tayo sa mass testing na call natin. So dapat continuous po yung ating call or mass testing, not just those with symptoms, but also different vulnerable population. Thank you.
Yes. Thank you very much, Carlo. So I think natamaan naman talaga yung main point, no, regarding the quarantine and the natural course of the disease. So the next question natin. I think our next question will be a two-parter. Okay. All right. I think from
Josh, would you like us to?
So from our YouTube comments, kasi we kind of have more comments on YouTube. Okay. So from Jongi 2. So how do we tell the government to be more open in data and processes and to accept the help of concerned citizen groups who contribute their expertise? So I think this is with regard to the engagement of the civil society organizations as well as the wider population. Yes.
Yep.
Okay. So how do we engage talaga the government to be more open with regards to data? I think na-mention naman ni Russel kanina, no, that there's a need to be open. But how do we call for that? How do we ensure that this is actually being done by? Sige, Russel, would you like to start muna?
Regarding sa i-engage yung sa
Sige, Russell or si Pia, do you want to answer that question?
Hello?
Yeah, I sort of, okay. Russell can go ahead. If okay na yung connection.
Regarding dun sa yung natin ma-enlist yung help ng mga concerned citizens sa actually yung pinakamaganda dyan dapat is yung mga contact tracing. Bale, actually, if we had a system in which yung mga data na nangagaling doon, bale, na export natin to and kumbaga, it's a way for normal people, yung mga, kahit yung mga may mga cellphone, para mag-engage sa citizen science. Pero sa ngayon nga, yung problem nga dito sa mga contact tracing app, na hihirapan sila sa implementation nito. Tsaka sa, kumbaga, very limited lang rin yung data na nakakalap natin dito sa, parang early June or July ata, na nasa 50,000 lang yung mga registered na mga data points dun sa SpaceSafe app. As compared to, let's say, yung 10 million sa, for example, sa NCR or sa iba pang mga dito, mga syudad. Tapos, regarding dun sa paano natin ma-ensure yung paano magiging mas open yung importante kasi dito yung pagiging mapagmasid and yung kumbaga na-mention ko nga na maging bukas yung isip ng mga kababayan natin sa kumbaga mga influences so syempre kasi kailangan natin i-baguhin yung mga narrative na pinapasok sa utak natin. Tapos yung regarding dun sa meron rin isa pang mga bill na pwede nating mag-clamor for like sa freedom of information bill. So meron regarding daw dun, currently meron daw tayong mga executive order para dun. Pero sa ngayon kasi very restricted siya and marami ng mga exceptions. So I'm not entirely sure kung meron mga kung ano yung mga specific na mga exceptions na pinutuhan. This was just referred to me sa alhamdulillah. Ayun. Bakit sa career naman? Ay, ito. Sorry. Ayun. Bale, parang mga 166 na exceptions sa FOI bill regarding sa So, parang siguro, in a way, nakaka-apekto lang siya sa mga contract efforts ng government ng mga LDO natin.
Okay, sige, si Pia.
Right, yeah. So regarding yung involvement ng other groups outside the government. So, di ba we have this contact tracing tool, and representatives of the center actually met with the local government unit officials and personnel regarding yung possible launch ng contact tracing tool for use here at least in the province or in the city ng Iloilo. And then I think they have this need to actually centralize everything. So they're saying na, we already have this app. So, why not use this alone? And so, just so it's easy isa lang yung where people can input data, where people can source their reports and analysis of data. But then again, yun like what Sir Carlo, I think, said earlier, overwhelmed yung public health system natin ngayon. So ang first, of course, yung target nila would be to slow down the spread of disease. So even though one of the approach would be to do or amplify contact tracing, we have limitations sa infrastructures natin, digital infrastructure, we have limitations sa personnel, we have limitations sa knowledge ng personnel who will use the app if it's finally launched. So there is the need to centralize, and it's good, but right now we need all the help that we can get. So that's where civic action groups and or other private groups can actually come in. And because they cannot do it all on their own, and then there are certain things that na hindi nila nakikita because yun nga, overwhelmed sila. In addition, of course, there's also the app na meron kami din ngayon na develop. This would be the personal protective equipment needs app. So usually kasi for donations, yung mga hospitals lang, yung particularly yung private and government hospitals, yung nakakakuha nun. So nakakalista sila. I think they have this they centralize everything in a certain platform so that dun lang din papasok yung lahat ng donations. But then there are smaller clinics and smaller healthcare facilities na hindi access tong platform na yon. And then this PPE needs app that we have actually nakakatulong sa smaller facilities na yon. Which again, nandun yung point na we need all the help that we can get. Kasi may ayaw man natin sa hindi, may mga marginalized communities, may marginalized institutions talaga na existing, especially in this pandemic.
Yes. Can I add something?
Yes, sige lang.
Yes. Hi, thank you for Mr. Russel and Ms. Pia, Dr. Pia, for those answers. And add ko lang yung kanina ko pong sinabi regarding rapid assessment. Kasi nga po, we don't see the process, kung paano pinaprocess yung mga data natin. So we have to see the bottlenecks, the problem, doon sa mga process flow before tayo makapunta doon sa end data natin. With the problems and bottlenecks na ma-figure out or maka-capture natin doon sa ating assessment, dito po pwedeng pumasok yung help ng different civic organizations, NGOs, experts that are external to the IATF and to the DOH. Aside from that, what can the public do para, I would say, pressure the DOH to do the open data? I think can be in the form of online campaign, diba? I can see people, prominent people pa nga actually commenting on the pages of DOH and IATF regarding their concerns about the data, about the solutions na pinapresent sa atin, kasi public tayo, diba? And then, lastly, I'd like to emphasize the point of Dr. Pia Zamora regarding the all help. Kailangan po talaga natin ng lahat ng tulong na makukuha natin sa mga tao, sa mga institutions na external doon po sa currently na naghahawak ng ating data. So, paano po yun? Kasi, di ba, maganda po kung meron tayong centralized efforts, centralized database na doon na lang titignan ng lahat. Oh, ito pala yung situation ng province ko, ito pala yung situation when it comes to PPEs, to contact tracing, ano pa yung pwede kong gawin? So, with the open data and with the centralized open data, mas magiging effective yung ating surveillance system.
All right. Okay. Sige, thank you very much to our speakers for very succinctly answering that question. Sige, sa next question, another comment again from YouTube. That is a two-parter from Mr. Thomas Benjamin Roca. So, nakakabahala yung sinabi ng DOH recently that it has become difficult for them to do contact tracing and that they've essentially dropped the ball in terms of tracing for most of the cases. So, second part. So, at this point in the epidemic, is contact tracing still a crucial part of the response compared to earlier in our COVID crisis timeline? Kasi presently, actually, this is something that is echoed by a lot of government institutions, that it is too late to do contact tracing by this part. Pero I want to get your comments with regards, since this is a very important and crucial part of the data. Thank you. Russel, do you have anything to answer this?
Actually, regarding dun sa viable pa ba talaga yung contact tracing? I don't, sa parang we just passed the point na rin na, kumbaga in Manila alone, in NCR alone, so kumbaga nagkakaroon na ng community infection na nga to the point na hindi na makita ng contact tracers natin, yung exact na pinanggalingan ng kunwari, kung sino yung disease or ano. So, siguro viable pa siya sa mga problem na, kumbaga, very low risk pa. Yung mga, di ba, we recently, dahil nga doon sa, parang yung pagpapadala ng mga stranded na individuals sa mga provinces, parang kasi may ilan sa kanila na COVID positive pala, na sila yung nagiging sanhi ng outbreak. Pero personally, dito sa NCR, I see medyo nag-aalangan nila akong sabihin na feasible pa siya. Not unless na, kumbaga, tataasan ni DOH, ni IATF yung manpower capability nila. Kasi at this point, nahihirapan na sila sa contact tracing nila.
Okay. Thank you. CP, would you comment anything, especially sa Metro Manila or those areas na sobrang overwhelmed talaga yung kanilang contact tracers with the surge of cases?
Ayun. I agree with Russell. So, even, I think it was Dr. Vergara who said, I think yung isang DOH na meet na press conference, na it's actually pointless na to do contact tracing, I think, in NCR, and of course those na matataas na talaga yung kaso, because you just have to expect that almost everyone has it. They just don't show the symptoms yet. But I also agree with Russell na for regions wherein controlled pa siya, so contact tracing is still a must for me, and it will still work in order to prevent or curb the spread of disease.
Okay, Carlo?
Hi. So you're asking if contact tracing is still viable at this point with the skyrocketing number of cases that we have. If we want to reopen our economy, if you want to prevent further transmissions, if you don't want another lockdown, guys, we should elevate, we should improve our contact tracing efforts, not only in the provinces, but also in the Metro Manila, wherein napakarami yung cases natin, di ba? Contact tracing, hindi siya, ano ba? Okay, contact tracing will not eliminate COVID-19, but will not eliminate COVID-19, di ba? It will further identify the further transmission, so that also if we identify you as a close contact base, we can isolate you, we can treat you if you become positive. So the goal of the contact tracing is not to eliminate the virus, but to lessen the further transmission of the virus. So at this point, of course, it is still important and very crucial po siya at our current stage.
Okay. So thank you very much, Carlo. So with regards to that, no, dahil connected siya dun sa main sinabi mo na kanina, our last question na lang for today is this one. Is there basis actually to revert the NCR to MECQ or ECQ as the government continuously pronounces? So based on the data, di ba, lumalabas nga na tumataas din yung cases natin. They have set the target that if we reach 85,000 by the end of July, then we will, NCR will move back to an ECQ, as well as, all those other areas na napakataas ng mga parameters. Sige, Russell.
Actually, marami ng mga experts na nag-agree na, for example, sa mga updates ni Dr. Tony, bali, nagkakal na rin siya na revert na nga sa more stringent plan. Tapos, regarding kasi sa yung position kasi ng ECQ, talagang siya, yung purpose lang naman talaga niya, ma-prevent yung ma-overload yung healthcare system natin. Pero, in fact, nasa critical level na kasi yung hospital distribution. marami na, yung nagiging primary question na lang dito is, will the government want to impose another lockdown, yung kumbaga to sacrifice yung ekonomiya, or instead just keeping status quo, then tataas pa rin. Sa ngayon kasi mukhang I'll be, parang ina-outlays lang ni COVID yung capabilities ng government natin. Sa ngayon. Pero of course, hopefully, mag-improve pa rin yung nila. Mag-improve yung, for example, yung compare nila ng mga contact tracers, yung testing capabilities nila, at least, ma-increase na yun. Yun lang talaga yung possible na how do you say this? Yung viable na solution para sa government.
Mhm. Sige. Thank you, Russell. So, Pia, may masasabi ka pa regarding that?
Dami kasing issues, if they have to revert back to MECQ or whatever form of quarantine. But the real question is, para saan ba yung ECQ? And whatever they plan to do during that ECQ, will they be able to do it? Kasi personally, kung pointless na din. I mean, the last 3 months, maybe there were some improvements, but there were a lot of inadequacies, there were a lot of limitations still. So what will that ECQ period give us, or that additional ECQ period give us? So that's the real question, actually. That's what they have to think of. I have no question whether we want to revert back. It's just what are they going to do with that ECQ period? That's
very important question. Yeah. Sige, Carlo, anything you would like to add to that?
Yes, I'd like to add regarding the to MECQ or ECQ. My answer is it depends. So if we do mass testing, so if we test all frontliners, if we test those people with epidemiologic link, regardless of their clinical links, or regardless if they're symptomatic or asymptomatic, if we test people in the communities that are considered to be high risk, then we can go on with our GCQ and improve, reopen our economy kasi nagte-testing tayo eh. So we can identify people na dapat ma-isolate lang, di ba? Or dapat ma-quarantine if they're close contacts. But we can also view ECQ or MECQ or ECQ or these lockdowns as health promotion. Pwede natin siyang tignan as health promotion, di ba? Kasi the government is doing something para ma-achieve natin yung hindi yung para ma-prevent natin yung further transmission of the virus. But my only problem with that is, tama si Dr. Pia and Russell, this lockdown should be an avenue or opportunity for the government to produce more humane or comprehensive na solution. So, pag mag-ECQ tayo, I said it is imperative for the government to give the people equal chance regarding food, regarding their mental health. So I think we should have more efficient ayuda system or yung SAP, SAP, di ba?
Yung welfare ng mga tao.
The social welfare din. So we have to look into this different external to health, di ba? External sila sa health pero nakaka-affect sila sa health din eh. So we have to look into these different sectors then if we're reverting back to these harder lockdowns.
Okay. Sige. So thank you very much for the answers to those questions, and I think medyo na-cover naman natin yung most part. For if there are any other questions, you can leave it in the comments as well of the rest of the videos, and we'll try our best to answer them even after and during the replay. Or if anyone wants to ask more questions. Sige. So before we end, some closing words or closing remarks from our speakers before we finish. Medyo overtime na din tayo. Sige, Sir Russell?
Thank you, Lauren, for listening. Actually, this is my first webinar, nahatak lang. Nahatak ako ng mga members sa pero I'm happy na nakapag-participate na ako sa discussion na ito. Kaya paano pa ang contribution? Kumbaga, ambag. Ambag na rin sa ating lipunan. Thank you.
Okay, thank you very much, Russel. Sige, Doc Pia, any last words? Any
Yeah.
parting remarks?
Again, thank you for having us, Josh. So, I guess yun nga, parting words would be all hands on deck tayo dito. So, the government should be able to also appreciate and also acknowledge the efforts of groups outside the government who are actually keen on helping their efforts against COVID-19. And yeah, basically that's it. Parang thank you again.
Okay, salamat, Pia. Okay, and then Carlo, any last words as a reactor to the entire activity?
Yes, I'd like to thank the Coalition for People's Right to Health for inviting me as a reactor to the presentations of Mr. Russell and Dr. Pia. So I'd like to remind the public lang regarding our 3 Cs. So avoid 3 Cs, crowded places, close contact settings, and confined and enclosed places. And remember your 3 Ws. So that's 3 Cs and 3 Ws. 3 Ws, wear masks, wash your hands, and watch your distance. But ultimately, I encourage the public to be vigilant regarding our data, regarding hindi lang yung data regarding dun sa mga dapat na binibigay na solution sa atin. Dapat acceptable sila doon sa population natin. Dapat maramdaman siya ng lahat, hindi lang po ng mga piling mga anak ng Diyos. Gano'n. And I'd like to remind everyone that COVID-19 problem should not be expert-based. I mean, hindi dapat mga expert lang yung naglalaro when it comes to COVID-19. It is a public health problem. It is a public health affair. Everyone, I am encouraging everyone na, yun nga, maging vigilant and maging involved doon sa ating solutions regarding pag-flatten ng ating curve and ng pag-raise ng ating bar.
Okay, thank you very much, Carlo, sa pag-sum up natin ng ating discussion ngayon. So, the Coalition for People's Right to Health would like to thank very much sa ating speakers, si Mr. Russel Santos, Dr. Pia Zamora, and Mr. Carlo Lorenzo. Thank you very much for your time sa pagtulong sa atin na pag-discuss ng ating presentation and yung ating discussion ngayon, no, kung paano at para kanino ba dapat ginagawa yung ating datos sa COVID-19. Okay, so before we end, just to remind everyone, ano na ba talaga yung mga nangyayari sa ngayon. Again, we discussed that. Napakita naman natin para kanino ba talaga dapat yung datos. So just to point vis-a-vis dun sa mga nangyayari ngayon. Sige, yung closing slide lang natin. Okay. So this is yung nangyari before, back in earlier in this July na nagkakaroon daw ng significant volume of data. So the DOH would frequently mention na because daw of that problems in validation and those problems that that were already discussed kanina, we have to look at this data in a different way. Hindi lang siya datos ng COVID-19. This is our data as a people, datos natin ito na ito ay open for the public and it is information about the public. So syempre at the end of the day, kanino ba talaga, hindi lang siya responsibilidad ng Department of Health, responsibilidad natin siyang lahat, pero syempre pangunahin na kailangan pagbutihin ang paglabas ng datos ng Department of Health bilang ang talagang mga may hawak at may-ari ng datos ay talagang ang mamamayan. Kaya kailangan talaga ipanawagan talaga natin na maging maayos yung paglabas ng datos, maging maayos yung pagmasid natin ng ating mga impormasyon na lumalabas para malaman talaga natin ano ba talaga ang tunay na kalagayan, ano ba talaga ang tamang dapat na ginagawa sa ating mga information na lalabas sa COVID-19. Dapat po ba nakakatakot? Dapat po ba nakaka-reassure? At the end of the day, dapat mapalakas natin yung ating pag-appreciate of the information and yung pagbantay natin kung ano ba talaga yung lumalabas. So again, na-mention nga earlier, yung panawagan nga natin that it's really because of this delay sa testing, sa laboratory, sa validation, lalong-lalo na sa datos, and yung contact tracing. Kailangan maging maayos yung mga ginagawa natin ng mga ito para makalabas ng dekalidad na datos na ma-appreciate at mapagmamayari ng mamamayan. At syempre, tuloy pa rin yung ating panawagan para sa mass testing, sa pagtaas ng kapasidad ng ating mga laboratorio, ang aggressive na contact tracing, at syempre, discuss natin ngayon, yung pag-improve natin ng data management na hindi lang dapat siya hinahawakan at binabakuran ng ating pamahalaan, kundi dapat binubuksan sa publiko at nakikiisa at participate ang ating mamamayan sa pag-generate ng datos at sa paggawa ng maayos at pagsigurado na nakukuha talaga ng datos yung tamang picture ng ating COVID-19 pandemic at hindi yung ginagamit lamang para sa pagpapalusot o kaya sa pagkakaroon ng mga approaches na nagva-validate dun sa inefficiencies ng iba. No? Dapat talaga pinapakita niya yung tunay na kalagayan at kayang tanggapin at hindi napipikon kapag napo-point out na mayroong mga pagkukulang sa ating mga datos at sa ating mga ginagawa sa COVID-19 at kailangan talagang tuloy-tuloy no yung pananagutan hindi lang sa datos kundi sa karapatan sa kalusugan ng bawat mamamayan at kailangan ma-address po itong mga delays and backlogs at ang maayos na datos. At ulit, no, so yung ating panawagan, no, yung pag-raise the bar, ito mga po yung ating Raise the Bar series. Kaya kailangan talaga tuloy ang ating panawagan sa maayos na datos, maayos na testing, maayos na kalidad ng ating serbisyong pangkalusugan. Kaya tuloy po tayo sa pananawagan na hindi lang po i-flatten ang curve, kundi i-raise the bar sa ating health standards, sa ating pagsagot sa COVID-19 at sa pagsagot sa karapatan sa kalusugan sa hinaharap. So maraming salamat po ulit sa pag-join sa aming webinar sa hapon na ito at we look forward na sumama po sila ulit sa ating mga susunod na webinar sa mga susunod na linggo. Maraming salamat muli kay Dr. Pia, kay Mr. Russel and kay Mr. Carlo sa ating talakayan nitong hapon na ito. Maraming salamat po at tuloy lang po yung pagsunod sa ating Facebook page at sa YouTube live stream natin sa ating mga susunod pa na webinar sa ating Raise the Bar series kasama ng Coalition for People's Right to Health. Muli, ako po si Dr. Agustin Pedro, ang co-convenor ng Coalition for People's Right to Health. Magandang hapon at magpakalusog po tayong lahat. Salamat po.